of color in this entire country. As a state, we see profound disparities in health outcomes for people of color. Thank you.
And this legislation is going to do something about that problem. We are thrilled that this legislation is endorsed by county leaders all across, county and city leaders across Maryland, and we're thrilled that one of the top public health leaders in our state is here to talk about that support, Howard County Executive Calvin Ball.
Well, good afternoon, everyone, and thank you so much, Vinny, for your leadership. The COVID-19 pandemic has further exacerbated the need for accessible and affordable health care in our state and across the nation. By leveraging state and federal funding, Senate Bill 632 and House Bill 709 would provide necessary subsidies to small businesses and nonprofits while decreasing their costs of providing health insurance for their employees. On behalf of county executives Alsobrooks, Elrich, Gardner, Glassman, Olszewski, Pittman, and Mayor Scott, we express emphatic support for this important initiative. I'd like to commend Senators Katie Fry-Hester, Brian Feldman, as well as delegates Robin Lewis and Brooke Learman. We wouldn't be here without their work and the incredible advocacy and collaboration by the Maryland Healthcare for All Coalition, headed by the formidable Vinnie DeMarco, as well as partners like Willie Flowers and the NAACP. During the open enrollment period, more than 181,000 Marylanders enrolled in qualified health plan on the Maryland Health Benefit Exchange, including more than 11,000 Howard County residents. These plans cover routine and preventative health benefits, including doctor visits, prescriptions, mental health services, and much more. Howard County is home to more than 10,000 small businesses, and this vital legislation will help approximately 7,000 of them. Partnerships between government, public, private sector stakeholders will help Maryland residents receive necessary medical care for themselves and their families. This bipartisan initiative, and widely supported by local chambers of commerce, is not only helpful for our small businesses and nonprofits, but it will be a lifeline to employ a workforce that is the backbone of our community. We want to reinforce our support of our colleagues across the region and would employ legislators to move forward with this legislation. And now it's my honor to turn it back to Vinny.
Thank you. Thank you, Mr. County Executive. Thank you very much. I mentioned earlier the Maryland Health Insurance Coverage Protection Commission, co-chaired by Senator Brian Feldman. No one has done more for health care expansion and health care quality in Maryland than Senator Feldman, and we're thrilled that he's a co-sponsor of this legislation. Senator Feldman?
Thank you, Vinny. Let me just sort of start maybe with that. The reality is we've done some tremendous things here in the state of Maryland the last few years, very innovative, first in the nation things. The first easy enrollment program in the United States, a 2-year subsidy for young adults that we rolled out at County Executive Ball's office in Howard County, the largest reinsurance program in the United States, all to cut in half our rate of uninsured in the state. And they were all creative. And Katie Fry-Hester, the sponsor of this bill, this particular legislation, which will be heard in the Finance Committee today, is very much within that same mold. I just want to give her another shout out. About 2 years ago, she created herself a new small business bipartisan caucus here in the state Senate. So this is a bit of an outgrowth of that. This is good legislation for the employees. It's good, great piece of legislation for the employers, and it's a great piece of legislation for the entire state of Maryland on multiple fronts. So let's start today with a big, strong bill hearing in the Finance Committee and take it from there and get it over the House. And thank you, Vinny, for a minute or two.
Thank you, Senator Feldman, Vice Chair of that committee. And also with us is another member of the Finance Committee who was the lead sponsor of the critically important Prescription Drug Affordability Board bill we passed in 2019, one of the first in the nation, along with easy enrollment. Senator Kathy Klausmeyer, who's here also. Senator, do you want to say? Okay. Thank you, Senator Klausmeyer, for your leadership. On the Finance Committee. Thank you. On the Finance Committee. Well, I got 2 votes. Yay. So, and now another delegate who's a co-sponsor is one of our heroes, Delegate Brooke Learman, who really has fought hard for public health in the Maryland General Assembly, and was one of the people who helped us get the message out about the Prescription Drug Affordability Board, easy enrollment, and the other laws we've passed. We're thrilled that she's a co-sponsor. I know she'll do a lot to get the bill enacted. Delegate Brooke Learman.
Thank you, Vinny, for pulling us together, and thank you all of you for being here. You know, I happen to be driving around the state a lot these days and talking to a lot of small business owners. And one of the challenges that our small business owners are encountering are just rising costs. And they want to keep their employees employed. They want to be working with them and growing their businesses, but too often they're not able to provide health insurance. So at a time when the state of Maryland is receiving an additional $7 billion because of the Infrastructure and Investment Jobs Act, and we already have a $2 billion general fund surplus, now is really the time to do everything possible to support our small businesses and the people who work for them. These funds, through this legislation, will help subsidize our premium costs. These funds will make it far more affordable for employers to provide this benefit to the people who work for them. And that, of course, will lead to more working people signing up for health insurance. This not only protects them, it brings down the cost of healthcare for everybody, right? I think one of the things that we saw throughout this pandemic is the importance of leaving nobody behind, right? Everybody needs to have access to great health care, and that means having access to great health insurance. So I'm excited to be supporting this legislation and thrilled to be up here with everyone. Thank you.
Thank you. Thank you. Thank you, Delegate Learman. The legislators here, of course, got all this done over the years, but it wouldn't have happened without the coalition of groups that came together to make it happen, and sometimes overcoming a powerful opposition. And one of the most important groups in all those coalitions was the Maryland NAACP, who fought hard for all of the progress we've made in Maryland. And we're thrilled that Willie Flowers, the president of the Maryland Conference of NAACP branches, is here to talk about this bill. Willie Flowers is a great leader, and his organization is going to help make sure this bill gets enacted. Mr. Flowers?
I want to thank Benny for just allowing me to be a part of this dream team that you see. The story about universal health care started, as everybody knows, in 1992 when I was awakened to it. And I was actually a sophomore, I think, in college. And while everybody was excited about the Clinton election that night, the next morning in a political science class, one kid whose family had a small business, he was crying about it. And I didn't understand it. So it was kind of a wake-up call to me that he expressed that his family was going to have to have health care for employees, and was going to turn them, close their business. And it was like a shock to me, like, you know, but it was a reality. As we know, the history about the universal health care did not happen, and we go on up to Obama. And the button for all of this is this legislation, because it gives an opportunity for businesses and for people who work for small businesses to have health care, and that's extremely important. And while I didn't know in 1992 that in 2008, 2009, I would be the executive director of a small organization, I wouldn't like to say nonprofit because of this conversation, but I was fortunate enough, because of the work that Vinny did, to be a recipient of their initial Affordable Care Act grant. But even though I had the grant to hire people, and these organizers were going in communities to enroll people, I couldn't offer health care to them. And so if you understand the magnitude of that, just think about that for a second. So I want to applaud Vinny. I want to applaud everybody who took the opportunity to sponsor this bill and push it forward, and I look forward to the fight. Thank you.
Thank you. Thank you, Richard. Very much. Thank you. Now, this legislation is based on a law that was passed in 2007, the Working Families and Small Business Health Care Coverage Act, which provided $15 million in grants to small businesses, and hundreds of small businesses took advantage of that. That was phased out. We want to resuscitate it with this bill, which will provide subsidies for small businesses, including nonprofits and congregations. But one of the people who fought hard for that bill was Republican Delegate Rick Weldon, who was on HGO and fought hard for that bill. And I'm thrilled to say that Rick Weldon, who's now chair of the Frederick County Chamber of Commerce, is here today to speak about on behalf of the Maryland Association of Local Chamber of Commerce Executives. Local chambers of commerce all across the state support this. And Rick, former delegate, I'm thrilled you're here. Thanks for your past support, and thanks for being here now.
Thank you, Vinny. So the problem with being the last speaker at a press conference is all the good stuff has already been said, and I'm happy to be in that capacity. I'm also happy to be with Senator Klausmeyer. I had the good fortune to work with her, as well as Senator Feldman. So if we play a game of which of these things is not like the other, you get to ask me why a chamber CEO is amongst this distinguished group of public officials and community influencers. And I'll tell you why. Because this bill does the thing we should all be doing. This bill builds employer loyalty in a time when businesses are trying to recruit and hire workers. What better way than to say, here's a good HMO plan that will get you in to see your general practitioner so you don't enter our healthcare portal through your hospital emergency room. This bill will strengthen the Maryland Health Benefits Exchange. I'm so proud of the history of this General Assembly to build one of the best small group health insurance marketplaces in the world. And we wouldn't want to do anything, and those of us in the private sector wouldn't want to do anything to affect that. And finally, it adds insured population in our state, and that is our highest and best calling, and these men and women have dedicated their political careers to that, and I'm proud to stand with them and represent the Maryland Chamber of Commerce Executives Association and the tens of thousands of small businesses that will have the opportunity to benefit from this. So, Vinny, thank you very much.
Thank you. Thank you. Rick, and we'll hope we have the same success. Remember, Rick, that bill passed unanimously in your HGO committee, and we hope that this bill will also pass soon. So in conclusion, this legislation is really critical to build on the successes Maryland has made, and we'll make sure that we reach our goal of every Marylander having quality, affordable health care coverage. So I think that's it, and we're open to questions, I believe. Any questions?
Who is a qualified employer? The bill apparently terminates when the federal money runs out. So what are the benefits of the legislation while it lasts, and how much of a difference will it make?
It's a great question. There's a 5-year sunset in the bill. So the bill's in place for 5 years, and at which time we hope the legislature will consider re-upping it, but we wanted to make sure it's in effect for a while we still have the effects of the pandemic and people really need this. And the employer, the only limitation in the bill have to be less than 25 employees. We trust our Maryland Health Benefit Exchange to come up with other necessary parameters to make that work. We want to emphasize again, have the very best health benefit exchange in the country. Michelle Eberly, the executive director, and her team do a great job. We completely trust them to be able to implement it well. Any legislators want to add to that? Okay. Okay. All right. Any other questions? Okay, on to the hearing. Thank you.